launched this program that anybody who comes 85 or older honestly should have their treatment irrespective of their capacity to afford it. We will find a way to afford it, right? And that's what we've been doing. We've had a couple of centennials of Chennai, meaning people over 100 years. And it's a privilege to share time with them. Let's be honest. How often do you get to share time with people over 100 or close to 100? So what I would call our senior managed care program to help people in longevity, because human beings are getting older, we want them to get much older. And when you're a center of excellence, you want to help the whole country start thinking that way. So I think from that point of view, we believe that that area will have benefit not only of aspects like the clinical surgical outcomes, pediatrics, which there aren't any very strong hospitals in that area, gynecology, which there aren't very strong centers of excellence, tertiary or quaternary care centers in that area, but also in other areas where strong neurosurgery, orthopedics, oncology, gastroenterology. I mean, we have heads of pediatric nephrology that are now considered amongst the top clinical outcomes on the planet, right? And this is a small hospital in Chennai. This is not some big corporate hospital. This is not a hospital that has different values. Our values are very clear. I think we would like to grow old or young together, depending on how you look at it. And we like to do that as a family that grows bigger. And I think when you do that and you work with other institutions by your side, you will automatically be better. So, long answer to a short question. I think Velapanchavadi will be known hopefully for many things, but amongst that, for having the best centers of excellence in healthcare, because we already have the world's biggest eye hospital. So why not have the world's biggest center of excellence in areas like pediatrics, in wellness, and in longevity? I don't know what that feedback is. I think one of the other mics is on. Okay. So our target audience, if we're honest about it, I think it's everybody. But if you're asking me specifically, it is a consumer who wants to get healthy, right? If you want your loved ones to get healthy, if you want your loved ones to have value-based, if you want your loved ones to be safe, I think you should consider Mehta's. So today, a lot of hospitals say many things. I'll use a simple, I always like making things personal because at the end of the day, life is very personal. And healthcare, in my opinion, is personal. So every hospital that has 10 hospitals, 50 hospitals, to me that I don't understand what makes sense for them. Because for me, every customer has to be a personal one. My grandmother was operated in this hospital for orthopedics and for critical care. She had her patient care here, and this was, we're talking about the doctor who helped co-found this institution. Right? My grandfather in those days was also managed here for stroke and neuro issues, and also some cardiac. My father post cardiac was managed here. My aunt was managed here. My mother had brain surgery here to remove a tumor. My mother-in-law at the same time had was diagnosed with colon cancer, so she had her cancer cured here. I've had a gastro surgery here. Right. My daughter, I have twin daughters, they're 10. My daughter at the age of 7 had a pediatric surgery here. So I think at the end of the day, I trust this hospital with the lives of everything dear in me. And I think that is what makes Dr. Mehta's a little bit special, because if you actually look at where most doctors who work in many hospitals bring their loved ones, it tends to be Dr. Mehta's. Even when we have Dr. Gupta who's sitting, Dr. Gupta, you're here. Even when Dr. Gupta, he used to work with us many years ago. He then decided he needed a career break and work in a corporate hospital in the city. And a very famous corporate hospital in the city that had a very strong surgical department. For his loved ones, he was back at Dr. Mehta's, even there. Right? That's not the reason I brought him back. Right? He's a very capable and competent clinician as well as administrator. But I think we brought him back because we value those things that matter. If your surgical outcomes are strong, people will come. We are targeting the middle affordable income bracket, right? We are not cream on the top of the cup. If somebody wants to come who are creamy, please come. We will do our best to serve you. But honestly, our target customer is folks that are middle class, like most of our nurses, like most of our allied health techs, and like most of my junior doctors. That is exactly the target group, right? Folks like you and me, not the person who drives the Ferrari, the Porsche and the Maserati. I drive, none of the directors here drive those because we'd rather make sure the customer has a much better life and perhaps also leaves smiling because their wallet is also a bit, has something in it, right? Which is a bit different, right? I think you will find that if you talk to our doctors here that the focus on clinical outcomes, the focus on reducing costs to our customer is quite high. We're one of the few institutions that, even though most hospitals talk about how do we have higher costs and negotiate with insurance companies on those things, that we are actually focused on reducing costs and making sure the customer benefits from that. So quite a few of our services, for example, in maternity care this year, for example, in your first pediatric interventions, your first neonatal interventions, have the capacity to be served. And that is also why when we had that launch of our 85-year-old program, all outpatient for anybody over 85 is free at Mehta. It will be the same there. We will not be any different. All inpatient care for anybody close to 100 will be free. We are not going to change that. I think that is a value system of Dr. Mehta's. Right?
How many doctors will be working there?
To be honest, I can't give you a clear answer because I honestly don't know. Right? I can tell you here for 250 beds we have 500 doctors. Now it's a bit more than, it's about 560 or something like that. Every day there is a new doctor who wants to come and share time with us. That's the reality. But I think there with 1,000 beds just times 4, and I might get some idea, but I think we will see two different things in Dr. Mehta's in Velapanchavi. I think for those of you who come there, you will see the first automated, highly technology-centric outpatient, emergency, critical care and in-hospital ward care. What does this mean? Most people when they come and see a doctor, they want to meet the doctor. Correct? Most large corporate hospitals talk about EMR, the future of technology, and what do when they have this? They talk to the computer. They don't talk to the customer. So our view is you have to, if you care about the customer and the personal care of the customer, you have to be able to communicate and understand the customer's need, not just the health need, but their family situation. Are there things they can eat, can't eat? Are there exercises that they normally do in the day? Are there other activities they do that may make their treatment worse? Which happens everywhere, right? And for that you need to communicate with the customer and the family that is sitting in front of you, rather than a machine that you also need, because if you don't have the patient record, it means the next time the patient comes back. I mean, some of my top doctors, Dr. Tangvelu, Dr. Nyanabalan, Dr. Usha Shukla, they see 300 customers a day, right? I'm assuming after 10 days, I see maybe 20 people in my office a day. I struggle to remember them 5 years from now. How do you remember somebody after 50 years, right? You need a digital record. What we will see in Velapanchavi is something that if you are sitting in front of a consultant for 3 minutes, will take less than 30 seconds. If you're sitting in front of a doctor for 5 minutes, will take less than a minute. And if you sit in front of a doctor for 10 minutes, it will still be in a minute. What that means is the doctor will spend more time this way, talking to the customer, and less this way, but it will have both. So you will see a lot more technology there. There are some parts of this hospital that have already changed. If you go and see some of my internal, for every customer that has a lab test or a diagnostic test or a complaint, we have these TV screens in places that have bubbles. And the color of the bubble, like the red bubble, means that we are running late. When a bubble goes red in the hospital, everybody in the hospital knows there is a problem in that area. So the capacity for us to do something quickly is fast. The other thing we will see is we will be one of the first hospitals that is completely digital in-patient monitoring, meaning that every customer in critical care first, but then every customer in every bed, every customer who comes for outpatient will have a digital experience and not somebody spending 35 minutes taking their vitals, 25 minutes doing other things. You will see that happening much better in Velapanchal. So I think those are where I think there is an opportunity for maybe the optimization of number of doctors, number of nurses to be much better. Today that's very hard, right? Today you need a certain number of nurses per customer. Today you definitely need not only a doctor, and we're a center of excellence. That means that a lot of other hospitals send their customers to us, complicated cases to us, right? And when the complicated comes, typically what do they come for? They want a second or a third opinion. They've been told to take some complicated surgery, some very complicated procedures, or they've been told there's no hope going forward. In those situations, the same way as I want my mom cared for, my daughter cared for, my father and aunt cared for, I want the same thing for them, right? And that means that I need more specialists that talk to each other, that spend time. For example, my head of pediatrics there, Dr. Haripriya, should be able to comfortably talk to my head of emergency medicine, Dr. Adil, who should definitely be able to talk to my head of surgery, who should definitely be able to also borrow the wisdom of the folks at Mehta's here.